everyone, my name is Bashar, and in this video I'll be talking about burns, and these are the objectives that I'll be covering throughout this video. So let's begin by recapping the normal skin anatomy. Here's a section of our skin. We have three layers of the skin, obviously. The epidermis on the very top, the dermis, which is further divided into two layers, the papillary layer and the reticular layer, and then comes the subcutaneous or the hypodermis layer. Also, here we can see the main arteries and veins which are supplying the skin. They are actually supplying the hypodermis and the dermis. And then the small capillaries, as you can see, they branch off and supply all the way to the base of the epidermis. There are also many sensory nerve endings which are responsible for sensation. It should be pointed out that we normally have what is called opportunistic organisms or opportunistic bacteria, which are living on our skin. So any damage to the skin, such as a cut, can thus introduce bacteria to the inside of these damaged areas, causing complications. Similarly, if a person suffers from a burn injury, it can introduce bacteria and other organisms easily into the body and can cause significant problems. There are many causes of burns, such as thermal burns, like flame injuries, which are usually quite deep injuries and that's from direct contact with the flames. And contact burns are usually from touching a hot object, so like an iron or a hot plate. We've got also electrical burns. So electrical burns can be from direct contact with an electrical source. And as a current passes through the body, it converts into heat, and then it damages the tissue. And with chemical burns, this is when skin is exposed to types of acids or alkalines, or any other corrosive substances. Also, there's radiation burns. They can be from UV light or from radiotherapy treatments for cancer, for example. Also, there's inhalation burns from small particles of smoke, which can compromise the airways and cause significant lung injury. So let's learn a bit more about the pathophysiology and the mechanism of burns. An important aspect of burn assessment is to know the depth of burn. To make it simpler, just think of burns as being superficial burns or deep burns. So let's zoom into the skin here to look at what happens in a superficial burn and what happens in a deeper one. Let's take a look at the superficial burn first. Since it's a superficial burn, it will cause damage to the epidermis and sometimes the upper dermis, which is the papillary layer of the dermis. Superficial burns will damage the cells there in the epidermis, causing an inflammation, which will activate an immune response, and also will start recruiting immune cells around that area, such as mast cells and macrophages. And these cells will secrete pro-inflammatory cytokines, which will result in many things, and let's take them one by one. Okay, so first of all, these cytokines will stimulate nerve endings, as you can see here, around the dermis. And the sensory nerve endings here can be the ones that detect pain, for example. And pain, by the way, is an important feature of superficial burns. Some cytokines will cause increase in vascular permeability, and this will cause fluid to leak out and may lead to interstitial edema. Okay, and in some cases, it could result in hypotension. Remember that the increase in vascular permeability causes the fluid to leak out, and this fluid could potentially accumulate in one area, causing a blister on the skin. It can be seen on the skin surface. And if this blister is sensitive enough, it can rupture and release this fluid into the damaged skin surface. Thus, superficial burns have a moist appearance. The cytokines secreted by the cells above will also cause concurrent vasodilation, causing further hypotension in severe cases, and this vasodilation contributes to the warmth in the skin in the area, as well as causing blanching of the skin and erythema. And blanching means that when you press on the burnt skin surface, blood will quickly fill it up because of the increase in blood flow to that area. The blanching skin is also a feature of superficial burns. On the other hand, in deep burns, you have more than just damage to the epidermis and the upper part of the dermis. you have damage all the way down. It extends all the way to the hypodermis. So it's a pretty deep burn that can thus damage blood vessels in the skin. And because you have damaged blood vessels, everything will leak out and you have no blood supply to that area. So you eventually get this surface dry and it becomes non-blanching. And the non-blanching dryness is an important feature of deep burns. Also, deep burns that involve the reticular layer of the dermis can destroy nociceptors and other sensory nerve fibers. So initially pain can be detected, but as a sensory nerve fiber are damaged, you get hyposthesia, so you get reduction in sensation. Also, loss of sensation is an important feature of deep burns. Obviously, not all your blood supply is damaged or your blood vessels are damaged. The functional or the intact blood vessels react to the cytokines produced around the area, and so there will be increase in vascular permeability again, which will cause fluid to shift out, causing interstitial edema. And this huge amount of fluid coming out of the vessels will result in hypotension, and it could be severe enough that it could lead to circulatory shock. So superficial burns and deep burns are further classified into different degrees according to depth. In the superficial burns, there's the first and second degree. In the first degree, which is also called superficial burns, it is the least severe level of burn. Usually only affects the epidermis. And the symptoms include erythema, which is redness of the skin, and it is often painful to touch between 2 to 3 days. And it can be followed by peeling of skin. In the second degree burns, which are also known as superficial partial thickness burns, they are a moderate level of burn, and they usually contain the epidermis and the upper part of the dermis. And symptoms include a much darker red color than a first degree burn. Sometimes there's blistering, and it is very painful to touch. And if these blisters are sensitive enough, they could rupture, as we mentioned previously. And if they rupture, they could give the wet and shiny appearance of the skin surface. The special thing about the superficial burns is that there's no permanent scars most of the time, and the patient feels the pain. Moving on to deep burns, there are the third and fourth degree burns. The third degree burn is also known as deep partial thickness burn. They are very severe burns and they are very graphic as well. Basically, from the name, it affects most of the layers of the skin, the epidermis, the dermis, and to some extent it might involve the subcutaneous layer. Symptoms include dark brown or waxy white color. There is often charring of the skin, and it is almost like a leather texture. But what is important to remember, and what is going to be seen on a lot of tests as a trick question, is the fact that there is no pain in the third degree burn. Because, as we mentioned previously, the nerve cells have been damaged and they cannot feel the pain anymore. Actually, they could feel it when it was happening, but now when it becomes a third degree burn, they cannot feel it anymore. So they feel no pain at all. And the fourth degree burns are basically everything a third degree burn plus damage to deeper tissues. So they could extend to muscles, tendons, bones, and sometimes organs. They also gives leathery gray texture or appearance. Also, they are dry and inelastic, so there's no blisters. Um, the most important thing or the most essential features of deep burns is that there's no sensation, and as we mentioned, that is due to destroyed nerves and non-blanching surface because of destroyed vessels. Another classification of burns is according to the size of that burn. So it is expressed as a percentage of the total body surface area. Calculations only include second, third, and fourth degree burns. And this percentage classifies the severity of the injury. The clinical importance of burn size is fluid resuscitation. So if you have a small burn, you will not need very much amount of fluid. However, if you have a large burn, you will need a larger or a bigger amount of fluids. So to calculate the size of the burn, the entire patient would be considered as 100%, and then various portions that are out would be a subsequent percentage. So we use rule of 9, in which the sizes of the various areas are laid out. So the head is 9%, the upper extremity, each one is 9%, the chest is 18%, the back is 18 as well, and each of the lower extremities is 18 on its own. And as you can see, these are all simple multiples of 9. So there are three aspects that we have to take into consideration in which they could indicate hospital refer and admission for the patient. First of all, the depth. So the third and the fourth degrees are considered dangerous and needs interference immediately to avoid further damage. Secondly, the extent, which is basically the sum of the percentages. Lastly, the site. So if the face is involved, the problem is that the patient might enter in laryngeal edema and suffocation. If it is infliction areas like joints, it could result in contracture and then deformity in that joint. And if the perineum is involved, patient might enter reflex urine retention. And there are some cases or situations that are considered critical, like if the patient comes with more than 30% of the body having second degree burns, or more than 10% of the body having third or fourth degree burns, or third or fourth degree burns of the face, hands, feet, or genitals. Also burns that are affecting the airway. And the circumferential, which is basically around the body or around a whole limb, which could result in acute compartment syndrome.